Good evening and welcome to our Accure Acne Laser Talk webinar. I'm Dr. Barry LaBine. I'm a board-certified dermatologist with almost 3 decades of experience. I'm also the medical director of LaBine Aesthetic Center, and I wanted to announce tonight that we have a new tool in our belt to help treat and fight acne. There's a so-called new light in the fight to treat acne. We're extremely excited about this. We wanted to introduce this to our patients and people in this area. As many of you know, acne affects many people. It affects various body areas and it can cause pain and discomfort as well as leave scarring. It can greatly affect people. Over the years, we've had many treatments for acne, aiming at different areas of where acne is formed. However, this is a great breakthrough in technology to help treat that. And I can tell you that I'm extremely excited about this technology, and we're also excited to be one of the first in the country to offer this to our patients. Over the years, I've greatly enjoyed treating acne patients and helping them. And approximately 8 years ago, I was at a derm surgery conference, and I heard a speech by Dr. Rox Anderson, who is one of the legends in dermatologic laser surgery. And he was giving a talk on the history of lasers, and he has actually developed many of the theories that lasers are developed upon, and he's also developed many of the main lasers that we use in cutaneous surgery. At the very end of his talk, he mentioned that he had one more big battle that he wanted to climb, and that was to treat acne. And that caught my attention because I know that he not only is extremely professional, he has high integrity, but he provides technology and lasers that work. And he backs it with science and research prior to being used for the public. So I've paid attention to this for several years and saw the follow-ups and updates. And last November, this Accure Acne Laser was FDA approved in the United States. So these units are now starting to be used, and like I said, we're one of the first facilities in the country to start using this, and we're extremely excited. I would like to have you watch a short video by Dr. Rox Anderson, and he describes it a little bit more. Him and his colleagues with Dr. Sakamoto and their other team members spent many years developing and perfecting this technology.
Around the late 90s, I looked in the mirror and said, I want to cure acne. I don't care how I do it, I just want to do it. I'm Rox Anderson. I'm a professor of dermatology at Harvard Medical School. I practice at Mass General Hospital, and I am the director of the Wellman Center for Photomedicine, which is the world's largest lab where we study light. The Wellman Center itself has launched a lot of things that are now helping people. Starting a long time ago, we figured out that pulses of light could be used to selectively target microscopic things inside of tissue. And what got me started was taking care of kids with port wine stains. We made laser tattoo removal, we invented laser hair removal in the mid-90s. We also made the very first confocal microscope for diagnostics in the skin, which is now FDA approved and used to chase down skin cancer and other applications. Laser technology has really moved forward. I'm actually most proud of just helping people, because at the bottom line, it's like, if you know, what are we doing all this science and medicine for if you don't actually change the way we help people in a beneficial way? Then we haven't done our job. So that's what I like the most, is the feeling of actually making a difference. I'm happy to talk about acne. Sadly, it's still the #1 skin disease. And I say sadly because there's been a lot of brilliant work that's gone on. We have drugs and we have an understanding of what's going on with what causes acne. It's still very common. It's a pesky problem. The drugs have significant side effects and it interferes with social life. It's also the #1 cause of scarring on the face. I care because it affects so many people. I've learned years ago not to draw a line between things that cause disfigurement and interfere with your social life, that what you might say are cosmetic issues, and diseases that can limit life or, cause major health problems. The truth is, there's no clear dividing line. It's a common cause for suicide in teenagers. So acne, even though the disease itself may burn out, the effects of it doesn't. The story with Accure starts really with the people that are currently running that company. I had this stuff in my head about wanting to come up with a laser that would actually work for treating acne. And Christopher Carlton and his colleagues literally showed up one day and said, "Rox, what would you like to do?" It was a carte blanche. And I said, "Let's cure acne." It wasn't clear at first, can we pull this off? Can we get enough power, the right pulse duration? We had to figure out a sequence of optical pulses that would target the gland safely and effectively. A few twists and turns along the road, but then we finally got where we're going. The Accure laser is doing its job. It's doing it within a fairly narrow window of efficacy and safety. The efficacy of this laser to come in a fairly short time, you realize it's 3 or 4 treatments spaced a month apart, I think will compete in practice with oral retinoids for the patients who have significant acne. This laser is in a way colorblind. So many of the lasers are difficult to treat people of color because they're at wavelengths that are absorbed by melanin. This wavelength is not absorbed at all by melanin. So I think you will see a wide spectrum of benefit across the skin types. I think of durability as just simply how long does a treatment that's effective really work? And I think the answer will be that this is very durable response. But a lifetime of acne scarring is a big deal. So I view this as preventative, which is another form of durability. I think what people want is they just want to know the truth. If they're going to go through a series of treatments and put up with a little bit of downtime and the redness that goes with affecting the sebaceous glands, they want to know if it's worth it. And oftentimes, the durability is the issue. I'm pretty confident that the answer is a great answer there. The effectiveness is really good. My experience in the past has been that if you come up with something that really works and it's brand new and we don't have it, that somehow the world organizes itself in a way that allows it to get out the door. And, that's, I think, going to happen.
So it's very exciting, new, groundbreaking technology, and really working on an area at the root cause of acne, which is groundbreaking. So when you look at acne, I think it's important to understand how acne happens or is formed. So when you look at the skin, acne is much more common in areas where we have increased sebaceous glands like the face, the neck, the chest. And the sebaceous glands are the oil-secreting glands that make a product called sebum, which moves up our follicles and comes out on the skin and has a good purpose because it helps lubricate the skin, which we all need. It comes out through that opening along the pore, and as time goes on, we do have shedding of these epithelial cells along this follicle, and normally they migrate nicely up to the top. However, there are times when these pores can get clogged and they can trap that sebum in there, which causes acne. In addition to that clogging, you also have bacteria on the skin that migrate down this follicle, and when they get involved and intermixed with this sebum, create significant inflammation, and that's where you get the redness and the discomfort that comes with acne. So depending on the level where you plug along the follicle, you can have things like whiteheads. If it's more superficial, the keratin can get oxidized and give you the so-called blackhead. As there's more inflammation, you can also get pustules, or sometimes you can get the deep cysts. The more inflammation, the deeper it is, the more chance that you have at scarring. So over the years, we've had many treatments, topical treatments, pills, various things to work on the different levels, such as the plugging, the bacteria, the inflammation, and all of them have a role. But as most of you know, you have to be on those for many years sometimes. Sometimes they work, sometimes they don't. And this is the first time where we've really been able to use something to greatly target the sebaceous gland and try and get a long-term result. Now, we do have a medicine called Accutane that does work some on the sebaceous glands, and it does work for acne, and it's been the gold standard for quite some time. However, as most of you know, Accutane it does have potential side effects, and it has to be monitored very closely. So when you have the acne then, and you're using various modalities, your dermatologist can help sort that out. So what's different about the Accure Laser, however, is that it targets the sebaceous gland specifically. And it took a lot of time in research to figure out the wavelength of light that would target the sebum. So they figured out the wavelength of light to get the energy into that sebaceous gland, which then would cause the thermal damage or denaturing of the sebaceous gland. But what was important was they needed to do a few things. One is they had to figure out how to cool the skin and the epidermis and the dermis so they wouldn't cause damage to those areas. But also they had to figure out what they call the peak epidermal temperature, is how to get that energy down to that level and create that denaturing of the sebaceous gland. So we do have a video of that. So when you are using this laser, the laser comes on the epidermis. It has a special handpiece, and when it cools the epidermis to a certain temperature, the laser beam is emitted in pulses to target just the oil-secreting glands in the area. And as you can see from that schematic, the epidermis, the outer layer of the skin, and the dermis are protected from this cooling mechanism, so you're not creating problems such as scar tissue. And so you're putting all the energy where it needs to go. And that is where they spent most of their time doing the research. So if you look at this then underneath the microscope, you can take that skin and see where it actually works. So if you look at a normal histology of skin, you can see the different layers here, but down in here you're going to see the oil-secreting glands or sebaceous glands. In this type of skin where they're enlarged, you're going to see a lot of sebum coming up. After treatment, you can see where they're denatured, and these have shrunk down significantly, and you're not going to have that excess of sebum that is coming up that follicle and has a propensity to get plugged. So they've proven this in their studies by histology, which is really important, that not only are you having the clinical improvement, but we know why now, that it is very specific and it is targeting those areas. So if you look at it, they studied this, and in their clinical studies, they showed significant improvement in these patients. Generally, it's done as 4 treatments, and what they noticed that after the first treatment, there was already a 40% improvement in the majority of their patients in their FDA clinical trials. With each subsequent treatment, they got significant more improvement to the fact that after the 4th treatment, most of these patients had over 80% improvement and their acne, which is really important because that is equivalent to what we normally see with people that are on Accutane, which has previously been our gold standard of care. And what's really also important is that it appears to be durable. So these patients' results seem to last. And I think the data is out to almost 3 years now where these patients have maintained results, which is very exciting. So it looks like it's not only effective, safe, but also durable, which is a great thing when you're doing treatments. So when we're doing a treatment, how does this work? So patients will come into the office. We do a consult prior to make sure they're an adequate candidate. But they come into the office, their face is cleansed. Then you have to use a topical anesthesia. So we put a topical numbing medicine on, generally for approximately 30 to 45 minutes, because we want to make that area comfortable while we're treating. Once we have the numbing medicine protocol completed, it's cleansed off, and then we do a grid pattern on the face. And that's to make sure that we have adequate treatment of all the areas that need to be treated. So it's all mapped out with a grid. Protective eyewear is placed on the patient as well as all the staff, and all safety protocols are utilized. We then start the treatment, and we follow out this grid pattern to make sure that we're evenly treating all these areas. A treatment takes approximately, depending on the area, approximately 45 minutes or so. When the treatment is done, the face is cleansed again. We use sunscreen and we give them instructions how to take care of it. The biggest thing afterwards is most people can go on with their regular daily lives. We just want them to make sure that they're very careful in the sun. We then schedule their next treatment, so we do a series of 4 treatments 1 month apart. And if they have any questions or concerns, we're always available to discuss. We understand that it's a financial commitment to have laser therapies, and the approximate pricing on this depends on the area that is being treated. For example, a full face is approximately a $3,600 to $4,000 amount, which includes the 4 treatments. And we understand that's a significant financial burden for a lot of families. It's kind of like if people are getting braces. So we worked with a financing company to try and make it as accessible to our patients as possible. And we let the financing company work with you, but it appears that we can get this down to an amount that's affordable for most patients, in that $100 to $150 a month if your credit scores are within certain ranges. So I think that will help significantly make it accessible to patients. We have a few pictures here. These are from some of the clinical studies, and you can see the patients have had significant improvement of inflammatory acne. I also think it's important to know that this laser is so-called what we call colorblind. Some lasers we have to be extremely careful with darker skinned individuals. The nice thing about this laser is that we can use it in almost all skin types, which is very exciting. And the reason is the energy is being transmitted down deeper where the sebaceous glands are, and we're protecting the epidermis, so we don't have to worry as much about pigmentary changes as some of the lasers. This is just another example, and again, this is a darker skinned individual, and you can see pretty significant improvement after 4 treatments. We're going to have time then for a few questions and answer. At the end, if we don't get to your questions and answers, you can put them in the chat box, and someone from our office will be available to get back to you. So I'm going to put on my glasses as they come in. So the question is, how long do the results last? Well, we know from the clinical trials that it's approximately 3 years at this point. And the reason we know that it's 3 years is because that's how long the study's been. So that's as long as I can tell you, but what it appears is the results are durable, and it should be long-lasting results. You know, there may be a few patients that may need some topical agents longer term to, you know, maybe even help make their skin look a little bit better, like using Retin-A and stuff. But for the most part, it appears to be a durable, long-lasting result, which is quite exciting. The next question is, which areas can be treated? We can treat any area that is involved with acne. So most commonly it's the face, but we can treat the neck. We can treat the shoulder areas, the chest or the back, all the areas that are acne prone. Now the one important thing is that it would be very difficult to treat them all at the same setting, because we do use a topical numbing medicine. We have to be careful on the amounts that we use so we don't have any problems with like lidocaine toxicity. So we will have to be judicious in how many areas we can treat in one setting, but all those areas can be treated. The next question is, what is the discomfort level? So as we all know, pain is subjective, and so everybody has different responses to pain. But in all the studies and in our clinical patients that we have treated, it tends to be mild discomfort. The average would be approximately a 3 out of 10 on the discomfort level for most people. Some people hardly have any. We do have other things that we do try to do as well as prior. So some people might take some Tylenol or sometimes even antihistamines prior. But most people find it very tolerable and do well with the treatments. The next question is, what restrictions are there after treatment? There really aren't any restrictions afterwards. You can kind of go back to your regular life. If you are using anything abrasive topically or irritating the skin, we'll have you hold those for up to a week. Our biggest concern is that you are careful in the sun. So if you're outside doing yard work, etc., that we would want to make sure that you're wearing good sunscreen and reapplying it, just because we don't want a lot of sun on those areas and get a sunburn, etc. So we would ask you to be very careful in the sun. Sometimes people can have a little bit of a mild acne flare for up to 48 to 72 hours. Not everybody, but some patients. So if you are going to a huge social function, you might not want to do it the next day, just in case you're one of those people. But most people can live their normal life without restrictions. It looks like that's what we have for all the questions for now, but again, if you have any other questions, you can put those in the chat box. Someone from our office will get back to you. I want to thank you for taking the time to listen to us tonight. We are very excited about this technology. We're excited about helping people with acne because we think it'll make a very big difference in the lives of our patients. Thank you.